The movie that I chose for this project was called A Beautiful Mind. This movie was based on real events centered around the life of a man named Dr. John Nash, who became very famous for disproving a theory and suffered from a mental disease called schizophrenia. In the movie, John Nash started as a student at Princeton University, but was very antisocial, and he ended up becoming best friends with his roommate, Charlie, who had a niece. Later on in the movie, he becomes an undercover worker for a man he saw at the Pentagon, Parcher, doing important jobs for him. Throughout the movie, we get little hints about Nash's disease up until the point that he gets into the hospital, and we find out that the man he was working for, his roommate, and his roommate's niece were all hallucinations that he had been having. For the rest of the movie, Nash had to learn to deal with the disease and all of the results that came from it, which were extremely hard for him and all of his loved ones to deal with. His wife took it extremely hard, but by the end of the movie, John had learned to live with his disease and even ended up winning the Nobel Prize. Though he never did stop seeing his hallucinations, he just learned to ignore them. Schizophrenia is defined by the Mayo Clinic as a mental disorder in which people interpret reality abnormally. In the movie, they do a good job of portraying this disorder with the character of Dr. John Nash, who this movie's life is based off of. In the movie, many symptoms are portrayed. You see John struggle with hallucinations, unusual ways of thinking, flat affect, difficulty sustaining or beginning activities, a poor ability to use information for decision-making, as well as trouble focusing and or paying attention. In doing the research, I found that schizophrenia symptoms can be classified into three categories, and according to the National Institute of Mental Health, they are positive, negative, and cognitive. Positive symptoms can be defined as losing touch with reality, where they have hallucinations, delusions, thought disorders, and movement disorders. We see these symptoms throughout the movie with his college roommate Charlie, his roommate's niece Marcy, and Parcher, the gentleman that he believes he is working undercover for. Negative symptoms can be simplified to a disruption in the normal emotions and behaviors. Here is where we find the flat effects, reduced feelings of pleasure, difficulty sustaining and or beginning activities. Negative symptoms are seen in the movie when John cannot focus on classes and has a decreased desire to be intimate with his wife. Cognitive symptoms are those that create change in memory or thinking and are demonstrated with the poor ability to understand and use information as well as trouble focusing or paying attention. We see John struggle with cognitive symptoms when he is unable to have normal conversations with women that he likes without being direct about his desires. Based on my studies, I feel that the movie did a great job of representing schizophrenia and showing it in a realistic format. During the movie, they did not discuss or show any causal factor other than stating that it may have started in grad school. From all of my research, that I was unable to find an actual factual causative factor for schizophrenia. According to psychiatry.org, it is believed that a number of genetic and environmental factors contribute to causation, and life stressors may play a role in the disorder's onset and course. In the movie, John is committed to a mental hospital when he is given the diagnosis. This is not uncommon when a person is first diagnosed with schizophrenia. They are usually put into a mental hospital because the person and their loved ones don't quite know what's going on with them. While he is being hospitalized, we see John go into a room with nurses and doctors where he is placed on a bed in 4-point restraints and given an injection into his arm. He then falls to sleep, which is followed by violent seizure movements. Later on in the movie, we learn that this is referred to as insulin shock therapy. In an article from the Psychiatric Bulletin Royal College of Psychiatrists posted on www.ncbi.nlm.nih.gov, this was a common practice for patients until the 1960s. This practice did not cure schizophrenia, but it would rather put the patients in what was thought to be remission. Remissions lasted just around 2 years. The practice was no longer standardized when it was realized that the antipsychotic drugs that were being administered to people with schizophrenia were working, and it had an effect that was long-lasting, and it was a long-lasting method of managing the disease. John is then seen in the movie taking these medications, and towards the end of the movie, he tells of taking his medications as being a way that he has been able to keep the hallucinations from becoming real to him. Medications are the standard of care now for people with schizophrenia, but often people will quit taking the medications that are ordered. We see this in the movie when John secretly hides his pills in a drawer under his desk so that his wife doesn't realize that he has stopped taking them. This is when John begins to believe that the hallucinations are becoming real to him again. But after this, he realizes that he really needs to seriously get a grip on the stuff that's going on in his mind. Otherwise, his life will just keep spiraling out of control. Throughout the movie, we witness John's wife struggle with coming to terms with his illness, as well as getting to see how she chooses to stay by his side. During the process of dealing with this mental illness, she expresses that she wants to leave but feels guilty. She also later shows signs of anger, sorrow, and fear because of what her husband is going through. She ultimately decides to stay with John because she realizes that she loves him, he needs her, and that she has to stay with him so that they can raise their son together. I believe that this would be a very reasonable portrayal of what it would be like to be a typical family member of someone who is going through this disease and struggling with it. And I think that most people would support their loved ones who are going through this because there are so many resources available to families living with someone who has a mental illness these days. This movie also gave me a strong understanding of schizophrenia, but I still cannot even fathom living with this disorder. I think that it would be very challenging to keep the real world separate from the world that the mind creates, and that where the hallucinations try to take over. I also think that this could be a scary and lonely way of life, as often they don't have a lot of friends due to their difficulties being engaged with activities. It would be scary when people around you are telling you to ignore the hallucinations when, like John points out in the movie, he missed talking with his best friend, Charlie, his imaginary roommate. And it would also be difficult to be able to tell what is real and what is not real. I did thoroughly enjoy this movie though, and now I have a better understanding of how this particular disorder works. In my life, I have not personally dealt with anyone suffering from this mental illness, or for anything as severe as it for that matter. I do have little experience with mental disorders or people with certain disabilities, as I have relatives with them. Going into this project, my idea of what schizophrenia was very different than from what it actually is. This project has been very eye-opening for me and has made me realize that there's a lot more to it than just hearing voices in your head. I hope that other people will now take the time to learn more about this serious mental illness and others like it, so that they don't place it into a stereotypical box. It is extremely important to know that people suffering from this aren't crazy. They are normal human beings just like us, who have to learn to live with a disease that they can't control. I also hope that one day I will be able to educate my own kids about this subject so that they understand how to deal with anything like it if the situation arises.